All right, well, we'll go ahead and get started and folks can keep joining us as they can. Welcome to Family First Wednesdays. My name is Beth Ayers. I am the Family Peer Support Lead at Montana's Peer Network. Family First Wednesdays is our monthly webinar for families with children with any sort of special health care needs, including behavioral health, and for family peer supporters or those that work with families. We are currently promoting our Recovery and Wellness Conference in September, and those that are a family member get in free. And so to become a family member, just go to mtpeernetwork.org and you can join. That also gets you access to our new family Facebook page. So we're hoping to just kind of build a community of folks that have children or that work with families. Today, we have Christina here with us. She's with the Department of Public Health and Human Services. She's going to talk to us about the Big Sky Waiver and Community First Choice. And so I will turn it over to you, Christina, and you can let us know exactly what department you work in.
All right. Hi, everyone. Can everyone hear me okay? Just give a thumbs up if you can.
Yes.
My name is Christina Reese, as Beth said. I am the program manager for the Big Sky Waiver. I'm also the program manager for Home Health and Hospice. I'm with the Community Services Bureau, which is housed in the Senior and Long-Term Care Division with Department of Public Health and Human Services. So I'm going to share my screen here. My counterpart, Gloria Garceau Glasser, is ill today and unable to speak on behalf of CFC. So I'm going to do that for her, which is certainly not my area of expertise. So you guys bear with me as I try to stumble through those slides. Okay. So give me 1 second here while I share my screen. Okay. Can everyone see my screen? Okay. All right.
I can.
Awesome. So I'm going to speak to you guys about the Community Services Bureau and the services contained within the Community Services Bureau. So the mission of the Community Services Bureau is to address the needs of Medicaid-eligible Montanans who require assistance and support in meeting their ongoing health needs by developing, managing, funding, and ensuring quality in home-based services, which fosters independence and dignity, contains costs, and provides options to members. Essentially, it is the priority of the Community Services Bureau to keep people in their community whenever possible. So Medicaid state plan, I show a map here because navigating Medicaid is a little bit like navigating a very complicated road atlas. We're going to talk a little bit about the differences between Medicaid state plan and where CFC and PASS come into play. So Medicaid state fund really is just your typical normal Medicaid. So if somebody has Medicaid, they have normal Medicaid, it's just referred to as state plan. It's funded by Title 19 of the Social Security Act. That is what authorizes state plan services. Initially covered primary and acute healthcare services. Home health and personal care were added in the 1980s, which is Part 905A of the Social Security Act. And then Medicaid state plan also includes community first choice, personal assistance services, durable medical equipment, home health, hospice, Medicaid transportation, pharmacy, physician services, dental, and hospital services. The community first choice and personal assistance services. So you might hear me reference community first choice as CFC and personal assistance services as PASS. These are entitlement programs designed to provide long-term supportive care in the home setting for members. An entitlement program is essentially rights that are granted to citizens and certain non-citizens by federal law. These programs are either contributory or non-contributory. Non-contributory means the program benefits are available to participants regardless of whether or not they have contributed to the program. Programs through Medicaid enable thousands of elderly and disabled citizens to remain in their homes. The type of care authorized is tailored to each individual in a person-centered manner and dependent on their needs, living situation, and availability of caregivers. In order to be eligible for both CFC and PASS, and so individuals who are on Medicaid are referred to as members. And so you'll hear me say member throughout this presentation, and that just means somebody who's on Medicaid, somebody who participates in the programs offered by the Community Services Bureau. So to be eligible for CFC PASS, the member must have a health condition that limits his or her ability to perform activities of daily living, or ADLs. They must participate in the screening process, and they must be eligible for Medicaid. In addition to those requirements, in order to be eligible for CFC, a member must also meet level of care for a nursing home facility placement. Okay, so we have some basics here. The service must be allowed through federal regulations. The federal regulations are found in CFR, which stands for Code of Federal Regulations, typically number 42. Every service must be approved by CMS. So CMS is the Centers for Medicaid and Medicare. That is the federal agency that oversees Medicaid and Medicare. The service scope, duration, amount, and limits are outlined in the state plan pages or waiver application. And then reimbursement for the services is funded through both state and federal funding. Medicaid is always going to be the payer of last resort, which is also known as third-party liability. So if somebody is on Medicaid, but also is covered by another private health insurance, that private health insurance is going to pay first, and Medicaid will pay whatever the remaining balance is. Many services funded through Medicaid require prior authorization. CFC PASS requires a functional assessment for Mountain Pacific Quality Health. And so in speaking about eligibility, Mountain Pacific Quality Health is the organization or entity that performs eligibility assessments for CFC, for Community First Choice. And as I said before, in order to be eligible for Community First Choice, that functional assessment does need to indicate a nursing home level of care. So members who meet level of care criteria may be eligible for additional services if medically appropriate, such as the personal emergency response system, community integration, yard hazard removal, correspondence assistance. So PASS is a state plan entitlement service. So everybody who is approved for PASS is automatically reviewed for a Community First Choice. Currently, Community First Choice members account for 95% of enrollees, and PASS account for 5%. So PASS or CFC is a state plan entitlement Medicaid program with hands-on care being the focus. Because it is a state plan program, there are restrictions as to what can be authorized or provided. And an individual must be on full Medicaid to be eligible. So the goal of CFC PASS is to provide medically necessary in-home services to members whose acute or chronic health problems cause them to have functional limitations in performing their activities of daily living. The agency will develop and plan services using a person-centered planning approach that provides members with choice and control. So person-centered planning essentially indicates that the plan of care or services need to be designed and facilitated in a way that meets the members' choices and wishes as to how they wish to live their lives. And so person-centered planning, person-centered choice, that is something that you may hear me refer to throughout as well. So activities of daily living includes bathing, dressing, grooming, toileting, transferring, positioning, mobility, meal prep, eating, exercise, medication assistance. The member must have ADL needs to qualify for the program. So instrumental activities of daily living. So where the activities of daily living are your ADLs, these instrumental activities are IADLs. This would include light housekeeping, laundry, shopping. These are limited and depending on the activities of daily living needs. And medical escort for Medicaid members who need assistance en route or at the destination of medical appointments. So transportation would be available, or that medical escort piece. Additional services, such as community integration, which is assistance and support to participate in recreational and community activities. Yard hazard removal, which is safe access to the home. So that doesn't mean that somebody, if they're gonna do yard hazard removal, they're not gonna come in and mow the lawn and, you know, trim the bushes and all of that. If it's snowing outside, they're gonna come in and shovel the sidewalks so that a member can safely exit their home and safely enter a vehicle. So it is specific to safe entry and exit from a home. Correspondence assistance, which is assistance opening mail, filing records, and completing paperwork. The member must direct this, so they need to be able to be specific in what they're asking for. And then additional services, which would be skill acquisition training, the personal emergency response system, and then that medical escort piece. So CFC pass services are not services to maintain an entire household or family. They are not supervision or companionship. They are not habilitation aides or specially trained attendants. They do not provide pet care. They do not provide child care or babysitting. And they do not provide any service to replace a parental responsibility. So the primary role of the Medicaid provider is to enroll with Montana Medicaid through either opt-in or conduit, comply with all Medicaid administrative rules, comply with all policy and procedures, and comply with all program or provider type specific policy and procedures. Primary role of the state is to ensure the state and federal health care funds are not spent improperly, collect and report information necessary for effective program administration and accountability, resolve grievances by applicants, enrollees, and providers. So in order to refer somebody for past CFC, you can call Mountain Pacific Quality Health, and the number here is listed on the slide. Anybody can make a referral. So whether that's the member, him or herself, whether it's a family member, a caregiver, anybody who can speak to the member's needs. There is a home visit that's completed. So the NPQH nurse does travel to the member's home for an on-site assessment of the member's needs and authorized medically necessary care. The nurse then sends the authorization to the agency of the member's choice. So there are a number of agencies that provide this service, and the member is able to choose which agency they would like to look at. And then here is the phone number for the Medicaid Services Navigator on the slide as well. And I have shared these slides with Beth, so you guys should be able to get a copy of these with these phone numbers on them. So we're gonna switch gears a little bit and talk about the Big Sky Waiver. So essentially a waiver is, Medicaid waivers allow states to choose groups of people with particular needs and health conditions to receive tailor-made healthcare options at home or within the community. For example, some states provide waivers for care relating to developmental disabilities, traumatic brain injuries, AIDS, and substance use disorders. So if a state has determined that they have a population of individuals that are at risk of going into an institutional placement, so for example, for the Big Sky Waiver, that would be the elderly or individuals with a physical disability who are at risk of nursing home placement, Medicaid has basically said that under a waiver, the waiver can pay for things that Medicaid state plan wouldn't necessarily pay for in order to offset higher costs, such as an individual going into an institutional setting. Okay, so home and community-based waivers. Following federal guidelines, individual states can implement home and community-based service, HCBS waivers. They can choose how many HCBS waivers they would like and must demonstrate that the waiver service does not cost more than the same service in a healthcare facility, ensures a person's health and welfare, provides reasonable and adequate standards to meet a person's needs, and uses a person-centered, individualized plan of care. A waiver program allows the state to waive some requirements to meet the needs of individuals. For example, a waiver may help a person with an increased likelihood of requiring long-term care, such as those with behavioral issues or technologically dependent children. So Big Sky Waiver is designed to provide individuals with physical disabilities and or who are 65 years of age and older a choice of either receiving long-term care services in their community setting as an alternative to receiving long-term care settings and care services in an institutional setting, such as a nursing home. Again, as I stated, individuals served by Big Sky Waiver, like all individuals served with Community Services Bureau services, are referred to as members. Each member works with their case management team or independent advisor to individually develop a service plan and corresponding to budget to successfully meet identified needs. Sorry, guys, I'm trying to move this Zoom bar here because I can't read my slides. There we go. So regarding the Big Sky Waiver, the Big Sky Waiver essentially is driven by case management teams. Case management teams are region specific. So the state is divided up into 2 regions. There are case management teams in each region that run their own wait lists that manage the members on their caseload. On case management teams, there is a case manager and a nurse, and they provide a holistic approach to care planning. They should be looking at an individual's medical and psychosocial needs and then develop a plan of care based on the person's needs and choices. Each case management team has a fixed number of individuals they can serve per year, which does mean that there is a waiting list for the Big Sky Waiver. A plan of care is essentially going to be a document that drives the service providers working with a member. So it's going to identify a member's needs, and it's going to identify objectives to help a member meet those needs and put services in place specific to what those needs are. Under the Big Sky Waiver, there also is a self-direct option, which means that members can manage, hire, fire their own care team. So again, the person-centered plan of care, focusing on the member, how they want to live and what is important to him or her. This is a strength-based approach and really focuses on the member's current abilities and how those services should be implemented. Ultimate goals of the person-centered planning are increased member choice, participation, and independence, while also assuring health and safety. You'll hear me speak to member choice a lot throughout presenting on the Big Sky Waiver, because that is a fundamental belief of Big Sky Waiver, is that member choice is at the forefront of everything that we do. So the evaluation and referral process, like with CFC Pass, Mountain Pacific Quality Health manages the referral. So again, like with CFC Pass, anybody can make a referral to Mountain Pacific Quality Health by calling that 1-800 number. When Mountain Pacific does assess a new referral, they will speak to that person and kind of get an understanding of what their needs are. But they will also screen them for a variety of different programs that they do the functional assessment for. So they would screen them for CFC Pass. They would also screen them for the SDMI waiver, as well as for Big Sky Waiver. Mountain Pacific Quality Health has a referral hotline that is staffed 5 days a week. They have 3 reviewers available at all times, at least from 8 to 5, Monday through Friday. And they should be in contact with a member within 3 days of that referral. Once that level of care assessment is completed, and if that level of care assessment reflects a nursing home level of care, that level of care assessment is then sent to the appropriate case management team. So for example, if that member lives in Missoula, that level of care assessment is going to be sent to the Missoula Partners in Home Care Services team. They will then make contact with the member and assess what services the member is looking for and do what is needed to put the member on the wait list. In order, again, to be eligible, a member needs to be eligible for Medicaid. As I said, there are a fixed number of slots available for Big Sky Waiver members, which does mean that there is a wait list. Now, each case management team manages their own wait list, which is a contrast to the DD waiver. The DD waiver, my understanding is there is a state wait list that is managed by the state, whereas Big Sky Waiver is region specific. Each case management team manages their own wait list. Once a member comes off of the wait list, the case management team will complete what's called an MA 55. It's just a state form. That form is then sent to the Office of Public Assistance to do their processing on their end. Once the Office of Public Assistance sends that MA 55 back to the case management team, the member is officially considered on waiver. Like with CFC Pass, Big Sky Waiver also requires exhausting of third-party liability. So waiver is payer of last resort, meaning anything else that could pay for that service needs to be exhausted first. These are the services offered under Big Sky Waiver. We actually just, our waiver renewal was approved. And so, we have a new waiver draft up on the state website right now, and some of these with the new waiver being approved, there are some changes that'll be taking effect that we have not quite trained on yet, but some of these services will have changed and or dropped off. But for the most part, they should be the same. So as you can see, there's plethora of services here. I won't go through them individually, but if you guys have any questions about anything specific on here, please let me know. I can speak to them a little bit. So we're going to talk a little bit about settings. This may not apply as much to you guys. This applies really mostly to providers, in providers who are operating assisted living facilities. So HCBS settings refers to places where individuals with disabilities live and spend their days. These settings are designed to provide person-centered care in the home and community, addressing the needs of people with functional limitations who require assistance with everyday activities. Individuals residing in HCBS settings should have full access to the benefits of community living and are not unnecessarily segregated from the broader community. Settings should be free from institutional qualities. So essentially, settings is a federal requirement that basically protects members receiving services and ensures that they are entitled to live their lives the same way that individuals not receiving HCBS services live their lives. So if, I don't receive HCBS services and I have, privacy in my home, I have my own room, I have the right to decorate my home as I wish, members residing in an assisted living facility have these same rights. So settings must engage members in community life, be selected by the member and include an option for a private unit. So members should never be forced to live in a setting where they don't have a choice in roommates. If an assisted living facility does have shared rooms, the member should be able to choose his or her roommate or decline a shared room. Settings also ensure an individual's rights of privacy, dignity, and respect, and freedom from coercion and restraint, optimize member autonomy and independence, and facilitate member choice. So in residential settings, so in an assisted living facility, the member has the same rights, responsibilities, and protections from eviction that tenants have under the landlord-tenant laws of Montana. Members have a right to control their own schedules and have access to food at any time. Each member has privacy in their sleeping unit. Members can have visitors of their choosing at any time. The setting is physically accessible to the member. So what we see a lot of are in these resident agreements that assisted living facilities have, which is kind of similar to a lease, that there might be visiting hours. A member can only have visitors between the hours of 8 a.m. and 8 p.m. at night. Well, that is actually a settings compliance issue. Like myself living in my own home as a non-HCBS service member, I am allowed to have visitors at my residence whenever I want. And so those are some of the same things that need to be afforded to members receiving HCBS service. So that's just one example of member choice and member rights. is that if we are seeing some of those visiting hours in those resident agreements, that's an example of a non-compliance issue. Same thing with doors, locking doors. Members need to have locking doors on their units in an assisted living facility and that's to ensure that they have privacy. So those are just some examples of how settings impact Big Sky Waiver members. So settings that are not home and community based would be nursing facilities, institution for mental disease, intermediate care facilities for individuals with intellectual disabilities, hospitals, or any other location with institutional qualities. Then we have heightened scrutiny facilities. So a heightened scrutiny facility is one which has qualities of an institution and has the effect of isolating individuals from their broader community. Facilities that are identified as having these qualities are subject to a process called heightened scrutiny. So these are examples of facilities that would be subject to the heightened scrutiny process, which I'm not going to get into because it's really an internal process that we need to do if we discover a setting, and then we need to submit a packet of information to CMS for review. So any setting that is in a building owned by an institution or a hospital, any setting that is in a building on the grounds of or immediately adjacent to an institution or a hospital, or any other setting that has the effect of isolating individuals receiving HCBS from the broader community. So I'm going to talk a little bit about other programs through the Community Services Bureau. We talked about Big Sky Waiver. We talked about Community First Choice. I'm going to skip these because I already presented on them. Home Health Services is also a program offered under the Community Services Bureau. These services are provided by home health agencies for Medicaid members who are recovering from an acute illness, injury, or episode related to a medical condition. These are typically provided in a member's home and typically after a hospital stay. These are the services offered through home health. We have intermittent skilled nursing, occupational therapy, physical therapy, medical supplies, equipment and appliances, home health aid, and speech therapy. To be eligible for home health, a referral needs to come from the member's physician to the home health agency. This usually comes at the time of discharge from the hospital. The home health agency will then obtain prior authorization from Mountain Pacific Quality Health. And again, any member receiving home health obviously must be eligible for Medicaid. Hospice services. Hospice is a program of care and support for people who are terminally ill. Hospice focuses on comfort, not curing an illness, meaning it is palliative care only. However, children under the age of 18 years old can continue to receive curative treatment while receiving hospice services. In order to be eligible for hospice, the individual has to be eligible for Medicaid. The doctor and hospice medical director certify that the individual is terminally ill and has 6 months or less to live if the illness runs its normal course. That doesn't mean that if 6 months go by and the illness hasn't run its natural course, that the member is now off of hospice. That's just kind of that baseline to determine eligibility. Somebody could be on hospice for years, as long as they meet the qualifying eligibility requirements. The individual signs a statement choosing hospice care instead of other Medicare or Medicaid covered benefits to treat terminal illness. Medicare will pay for covered benefits for any health problems that are not related to the terminal illness. And then treatment does need to be delivered by a Medicare approved hospice program. So now we have aging services to improve independence. This is a state unit on aging, which administers a wide variety of senior-based services for Montana residents who are age 60 or older. Programs and services are primarily delivered by a network of 10 area agencies on aging, which reach all geographic areas of the state, with the goal of providing services that allow seniors to remain independent. Older adults are offered a choice in living and care arrangements. There are also programs to protect their rights and personal autonomy, and we'll go through those programs here. So the Aging Horizons newsletter, we have the area agencies on aging. On the website, there is a link to these different agencies. The Montana's Older American Act, there's also information contained there. The long-term care insurance, Montana Senior Medicare Portal, and the Aging and Disability Resource Center. Essentially what this is, and I'll provide the website, these are a compilation of resources that are helpful to Montana's seniors. I've gone through these. I think they're very valuable. So if you guys are working with or know of somebody who could benefit from any of these resources, please check them out. What I think the most helpful is resources on this website to navigate the very, very, very confusing world of Medicare and Medicaid. So here's my contact information, my email and my phone number if you guys want it. And I can scroll back to that very first page and share, or I'll put the website in the chat actually. But does anybody have any questions? You guys are a very quiet group.
I can start off with one. I know you said that each region has their own wait list for the Big Sky Waiver. Is there an average of how long that wait list is?
Oh gosh, I just looked at this the other day. What was it? So typically on average, people are on the wait list for approximately 90 days, though I think that wait time is a little bit longer now. The total number of people on the wait list in the state of Montana as of last week was a little over 300. Oh, and I see something in the chat. So really that's not that long on the wait list, even if it is a little over 90 days when you compare it to the 0208 waiver, which is the DD wait list, what it could be 10 years. And I see something in the chat here. I am going to put my contact information in the chat. I'll do that right now. Are there other questions?
I'll go again.
Go ahead.
I was just gonna say, I was interested in hearing the senior how the settings must be, having, you know, privacy, locking doors, things like that, is not something that I knew of prior to this. That's really interesting.
It is, and it has been a fairly complicated process for the state to implement. The settings requirement came about in 2014, and we are still working to. We are in a much better place now than we were even a year ago. But we are still working to make sure that all on-site visits have been completed for our assisted living facilities and that they're compliant. And if they're not compliant, we work to help bring them into compliance.
Does anybody else have any questions or comments?
This is Teresa Baldry. Christina, I just had a question for you. One of the resources I found very helpful under Big Sky Waiver is the HCBS information and summary fact sheet with the update and changes with the approval of the new waiver. I know that just got done, but will there be some work to up? I know it's so good, but then it's like, oh, and now there's just a few changes. Yeah. Looking forward to when I'm hoping that's a goal to have that updated soon, just because I like to be able to provide that resource.
Yes, and so we are in the process of scheduling trainings for our case management teams. The waiver renewal is posted on the website. So, you know, for those of you who want to read it, it's quite long. I think it's about 400 pages. But
I downloaded it.
Okay, I'm in the process of combing my way through it as well. So it is long, but it is helpful if you understand waiver stuff. So But yeah, so there are changes coming. Trainings will be set up and provided, and feel free to reach out and contact me if you have any more specific questions or want something more specific in terms of a training or something like that.
Thank you.
Where would somebody access that fact sheet?
Teresa, where did you say that you found that fact sheet? It should be on our website.
Okay.
Oh, go ahead, Teresa.
Dropped it into the chat for you.
Okay,
Oh,
thank you.
perfect. Thank you.
Our websites and our policy manuals are outdated, and so we are in the process of revamping and updating those as well. So you guys might see some old information on there.
I have a quick question if I can. I'm sorry, I actually totally spaced that you guys were doing this today, so I just joined, and so hopefully this isn't an inappropriate question, but my name is Shayna Carter and I'm in Kalispell, and our son just got approved for the Big Sky Waiver, and actually we just had the case managers at our house yesterday, and they weren't sure about this. If you self-direct for payment for patient or for the assistance, if you can also qualify for respite care. They said that there was some confusion with that and they had to reach out to somebody to find out. And I just didn't know.
So self-direct should also qualify for respite.
Okay. All right. So that's probably what I'll hear back from them then. They said that were told that if you self-direct, you don't qualify for it. So, all right. Thank you very much.
You're welcome.
Can I ask one more question?
Absolutely.
Okay. So they also weren't, I mean, this is all brand new to us. And so, and they weren't for sure, like under the health and wellness piece. Of course, I understand this program was created for the elderly, and that's why like people like us with small children, it's kind of like, I don't know. And so I had asked them, like, is there any assistance for like paying for example, like the Dream Adaptive Program up here in the Fly Valley to help with like skiing and things like that. They do have scholarships and whatnot, but like their funding is limited. So does the waiver help pay for like physical stuff like that for children on it?
Yeah, so part of the requirements for the waiver to pay for services such as that would need to be medically necessary, and it would need to be something that without which the member would be at risk of institutionalization. So policy is clear in that any good or service paid for by waiver cannot be purely for recreational purposes only.
Perfect. That clarifies for me. Thank you so much.
You're welcome.
And I would just put another plug in for the free membership. I know you weren't here for the beginning, Shayna, but Montana's Network has a free family membership. And with that, it connects you with others who have children with special health care needs. And so I am sure that there are lots of people out there that have a lot of great ideas and have, kind of found ways to help with those things. And so we do have a Facebook group you can post it on, or if you just want to send me a question on your own, I can reach out to the different families that are a part of it and see if they can get a hold of you.
Okay. Yeah. Thank you. That's a lot of it is like, I felt like the case managers are like, well, what do you need? And I'm like, I don't know. What can you do?
The case management team should be sitting down with you and reviewing all of the services in the policy manual with you. So they should be going through every service that Big Sky Waiver offers. And one that, I would specifically inquire about, not knowing anything about your specific situation, but one that I think it's often kind of overlooked is specialized childcare. So the waiver can help offset the cost of childcare if a child has needs that cannot be met in a typical childcare setting. But they should be going through all services with you.
Okay, and then what I might be in that group already. That you said is it the Montana Peer Network on Facebook?
Yes.
Okay, perfect. Yeah, you guys, I have learned so much through that Facebook group and I appreciate you so much. So, and then the only other question that they weren't sure about, and actually they directed me somewhere else and then I learned something different. He is actually he's 6 years old and he's got an IEP. And so we actually hired a private tutor this summer to help us get up or help him with things. And so I'd asked if there was anything to help with that. And they said that the IEP, initially they said the IEP needs to pay for it, but then they had told me to look at the Montana Education, the Montana Education Savings Account that just became active in May. And that's where they directed me. So I checked with that, but that is only for children that are in private schools, not in public school. And so they didn't know what else to say after that. So I don't know if there's any other resources, but that was the only other question that I had.
Yeah, I would ask your case manager about specialized childcare.
So that specialized childcare may help pay for tutoring.
Possibly if it meets criteria.
Okay, thank you.
But I guess I should reference to, you know, we discussed or I touched on third-party liability a little bit, and you are correct in that the IEP is going to offer services and supports and pay for things that that they should, but if it's a similar service or support that Big Sky Waiver offers, the IEP is going to be payer first resort, or at least before Big Sky Waiver. So if it's a service available through IEP, it needs to come in through IEP. Big Sky Waiver would pick up what IEP wouldn't pick up if there is still a need.
Okay, and that's kind of what I've come to the conclusion of at the end of the summer after we've paid for it out of pocket is we probably should have talked to the IEP team at the school before summer started and requested for summer school basically through the IEP. And so that's probably the better way to do it. Thank you.
You're welcome.
I really appreciate you guys so much. I told them actually when they were here yesterday that about this meeting today, and they were like, well, we should probably sit in on it. And I'm like, I don't know what it's going to be. I know it's going to be helpful, but.
Well, I'm always happy to come back.
Awesome. Yeah, I think this is the biggest group we've had. So there's definitely, I think, a lot of need and a lot of interest and yeah, education on it. So it's been good.
What I will say too is, you know, Big Sky Waiver, yes, it is a waiver for the elderly and physically disabled. But the Big Sky Waiver does, if eligibility requirements are met, children can be on Big Sky Waiver. And right now, currently, I think only 5% of our active members and 5% of our waitlist members are children. So, you know, I think if there is a need for Big Sky Waiver to reach out and help more children, I would love to see that percentage grow.
Wow, that's crazy to hear only 5%. So
Yeah.
some of the parents that I've talked to thought that if they were on the DD waiver list, that they could not have the Big Sky Waiver. And I told them, no, I think you can have the Big Sky Waiver and then you drop the Big Sky Waiver, right? When you get DD waiver.
Yeah, so you can be on wait list for, so Montana has 3 waivers, the SDMI waiver, which stands for severely disabling mental illness, the Big Sky waiver, which is for the elderly and physically disabled, and then the DD waiver, which is for adults and children with developmental disabilities or IQs below 70. You can be on multiple wait lists at the same time. However, and you can be on Big Sky Waiver and remain on wait lists for other waivers. So that is correct that someone can be on Big Sky Waiver and still be on the wait list for the DD waiver at the same time. If they were to come up on the DD waiver wait list, they would have to make a choice as to which waiver they would want to continue with because they can only be on one waiver.
Are there any other questions or comments? So it looks like there's a lot of information in the chat. Christina put her email and phone number. Teresa put in that link for the fact sheet. I put in my phone number and email. And then there's also the website link in there for DPHHS, Senior Long-Term Care. And then there's also the link to become a family member. And once you're a family member, you will receive the free code for the Recovery and Wellness Conference coming up in September in the e-newsletter, which comes out every 2 weeks. So if you have any questions on any of that, let me know. Any last minute questions?
Hi, my name's Carrie Tarter and I work for the Rural Institute. Thank you so much for this information. I'm putting together a regional transition binder for families and educators. And I'm wondering, we were going to just cover the 2 primary waivers, so the Big Sky and the 0208 comprehensive. But now I'm hearing about the SDMI, so that will probably be covered in there as well. I'm wondering if once I have a draft of the Big Sky portion, if I could get in contact with one of you to vet it for me.
I'd be happy to review it, and if you want to reach out to me via email, I put my email in the chat. I'd be happy to, review it or, provide any information that you're looking for.
Awesome. Thank you so much.
And if you want to email me, I can put you in contact with somebody who can speak with you about the SDMI waiver.
Oh, excellent. I'll reach out to you then after this. Thanks so much, Christina.
And just to clarify, the SDMI, they have to be 18, correct?
Correct. I believe that you can apply for the SDMI waiver, I believe 90 days before your 18th birthday, but it is 18.
Okay, great. And what's the, I can't for some reason see it in the chat. I think Beth had mentioned the Montana family, the link to join that, which I probably have already done, but what's that link again, Beth?
Sure. So if you go to, it's mtpeernetwork.org. If you go into let me see here, store, it would be under memberships, and there's the free family forum membership, and that's what you would technically put in your cart and purchase, but it's free.
Okay, thank you so much.
Yeah, you're welcome. And then also on there on mtpeernetwork.org, there is a family forum family forums divisions section, and it has lots of information, past videos. Sometimes we post these on there too, so it should have some information too for you. All right, I will send these slides out to everybody, and I will also, this recording will be up, and we're in the process of using a new virtual training system. And so we're kind of switching a lot of things over to it. And so I will send out the video. I'm not quite sure where we're going to be posting it at this point, but I will send that out to everybody of this, so that you guys can review the information, or if there was anyone that didn't get to join us or wasn't able to be here for the whole thing, you guys would be able to get the information. Well, Christina, thank you so much for coming. Obviously, this is a well-needed topic, and yeah, thank you for coming and explaining
Thank
everything.
you so much for having me, and it's nice to come to your group and present. So please feel free to reach out to me if you have any questions or need any additional information.
Absolutely. Thank you so much.
Thank you, everyone.
All right, we'll see you guys later. Have a good day.